Well, we have one of the pathologists. In fact, he's the lead pathologist in the autopsies of Anthony Tiaka and Levi Kofa, Dr. Benedict Kolee. He's now live on the line from Monrovia. Doc, it's a pleasure having you on Phoenix Radio.
Thank you. Thank you, Mr. Gardner.
Now, sir, let's go right into business. People have gotten this report at long last. Unfortunately, the jargons and terminologies used here are actually way above the layman's comprehension. So first, let's begin with the process that you commenced the autopsy with. Just drill us through what did you do and where did you take the samples for analysis?
All right, thank you. So I want to say a very big hello to the people of Maryland and the people listening to us everywhere. We want to say many thanks for the patience you exhibited and the love for country that you're showing since the unfortunate incidents of the passing of Levi. So in terms of the process, I'm going to drill us very briefly. I have a meeting, but I'm going to take time off to do that. You will recall that was a scientific work that was done. And somehow some of the languages, you don't have the equivalent of it in simple English. Hydrocephalus, those medical languages, you can break it down and then further. But I'm going to seek to do that. And I'm just going to very briefly refresh us. We all recall that on July 18 at about 10 p.m., Madam Harry Kofor, maybe the mother of Levi, reported to police that her little son went to Penwolf Academy in Crewtown in Harper and has not returned home. Also, the police and the community, mobilized and they were searching, and the body was found, all right, I think on the 20th at about 1:16 p.m. So a coroner jury was set up to establish the cause of death, and they were not. That's again consistent with the law of Liberia. Right. So those people checked, and they were not able to find what caused the death. So it was based on that we were asked to come and do a scientific work to establish the cause of death. So my colleague, Dr. Zobon Bikpate, and I went into Harper to do this work on the 1st of August. So there were questions. The police gave us this report that I just summarized. But there were questions that we sought to answer, all right? Okay, the ultimate goal was to find what really killed Levi. You will recall that Levi was found in Lake Shepherd. So the question we asked ourselves was he alive when he entered the lake, or was he already dead? Then we also sought to see if he was already dead when he entered the pond, then what caused that death? So it was a very extensive work that we did. So the autopsy was witnessed by a lot of people. I mean, up to 20 persons. I can't call their names here, but the grandfather was there. Mr. Kenneth Kofa was there. Annie Kofa was there. Alvin Zion, Brent Dior, Charles Goa, Wilhelmina Nouvel, Annie Morgan, Wilma Wilson, Helen Kolinke. I don't want to call all the names. That is unprecedented in the history of Liberia, but we did that for transparency. So that if there was a cop, if there was something that was there, we wanted everybody to see it. If there were things they saw that we didn't say in the report, it would really help for them to say it. But they were all there. The grandfather was there. They asked questions. We answered it. So we went on to do what we call the external body examination, where you look at the body from head to toe. We look at the head, we look at the face, we turn him over. The people were there when we were doing all of that to see how he was laying when he died. So you see, when people die, there's something we call hypostasis. When someone dies, the water that in the person. So if the person is laying down on his stomach, the water will go towards his stomach. If they are laying down on their back when they die, all the water in their body will settle down towards the back, all right? So when we do forensic work, that helps us to establish how the person was laying down when they died. How they were laying down when they died. So let's say, for example, if someone was, something happened to them, they were lying down on their back, and after some time, they got placed in the water, that will not change. That fluid will continue to remain on their back, all right? So we know that even though they are in the water, so in the case of Levi, when he was found, he was face down in the water. That is usually how people are when they drown. So we look at the neck region. We open the neck to see whether there were any injury to the neck muscles. The neck area, usually when people get something is done to them criminally, the neck muscles are affected. So we open the neck up, we check the neck muscles were fine. We open the tummy, we check the tummy was fine, the liver, everything. All of the organs, the kidney, the brain, the heart, the nose, everything was there, and we demonstrated it. The only thing that was there was an issue with one of his ears, all right? The lower portion of the ear was a little bit cut off, all right? So then we want to know, because, in the water, there are fish, there are creatures there that try to look for food as well, all right? So the question was, did someone, actually cut his ear off, or this thing happened while he was in the water? We're able to establish that happened while he was in the water, because the cut of the ear is not a straight edge. It's not a clean cut. The edges are jagged. If someone just pin something and pull it up, it will not be cut very clean. And again, that autopsy, I'm not sure you got the pictures, but the pictures are all in the autopsy that was submitted. So we look at all of that. So we could establish that this thing that cut, that not knife call it, all right? That something other than knife, cut this, and a fish thing, because you can see the teeth or whatsoever. We look at the kidneys, we look at the muscles were there, we didn't see, if someone hit your chest, all right, someone hit your, thigh, something like that, blood will settle under it. We check, we didn't find any blood under that. And again, 20 persons were in that place watching this. I call some of their names. We look at the pancreas, these are organs in the body, they were all looking, fairly well. We also open the brain, because we said, well, did someone hitting his head, to cause a damage to his head before, he was placed in the water. We look at the brain. The brain was a little bit, getting rotten, but we didn't find any blood in the brain, all right? So we did not stop there. We took samples from him, and that is some of the reason why, there was some delay with the report. Something from the liver. We took something from the stomach. We took something, small thing from the kidneys as well. So if someone gives someone poison, okay, so it goes to the liver. Sometimes it comes out to the kidney, then the person pee with it. So we took samples from all those areas to just check to see whether that's what we call the toxicology, whether someone gave something poisonous or something, all right? So we send that out of the country to our reference laboratory, and that laboratory analyzed it. They did not find any poison. The other thing I'd like to talk about also before proceeding is the aspect of his gastrointestinal system. That is the mouth, the throat, the windpipe, the stomach, the intestine, and all of that. We opened the intestine. There was no significant food in the intestine, because prior to the time we came, there was news around that, when they threw him in the water, there was gari in his mouth.
Mm-hmm. And I was just about to ask that.
There can bear me witness that we did not demonstrate any gari in his mouth when we saw him. Also, when we opened his stomach was almost empty. There was no gari in his stomach. For the purpose of the education of everybody, if I sit down here right now and have my breakfast, it will take at least 4 hours for that food to leave my stomach. So if someone ate gari in 4 hours to the point that some was in the mouth when they pick it up, very obviously that gari will have been in his stomach when we opened the stomach up. There was no gari in his stomach. We didn't demonstrate any gari in his mouth. And the fact that anything looking white does not necessarily mean gari. There is sand there, there are dead particles in the water. It could have been just some of that was around his mouth. So I'll talk about the toxicology. Then we also went on to take some little thin section from the lungs. The lung is the area, the thing we use when we are breathing in our chest. That when we are breathing now and taking air, it go into my lung. All right. So when people get drowned, the water goes in the lung. Other things go in the lung. But again, know that we had checked the entire body. We did not find any mark of violence. We did find the only cut that was on him was the one that the man who embalmed him. And again, the 20 persons who were there in the suit can bear me witness that they were there when that embalmer indicated to them that the cut that was in his thigh, he the one made the cut so that he could put the chemical there for the body not to get rotting. That the only cut that we saw on him. We didn't find any other cut that was on him at the time. All right. So, but we still took, sections from the lung. We took small pieces of lung. We took it for analysis. to see what would have happened to the lung. So in that lung, basically what we saw was that there was edema, there was like fluid inside the lung. So if someone is alive and you go in the water, it's difficult for the water to enter the lung because this person must have breathed the water in for the water to enter the lung. Water can go there, yes, but I'm saying it is difficult for water to go there, okay? So we also saw something in the lung which you call emphysema. Some of the alveolar sac, the small bag that the air can go in when we breathe, some of them looking big, they were dilated, they were looking big, all right? So this can happen when people get in the water alive, and when they are drowning, they will usually go up on top of the water, they catch some air, then they go down again and they are not able to bring the air out when they are down in the water, all right? So that can make that alveolar sac to get enlarged. So when we put all of that together, all right, for the toxicology we did and all of that, and the fact that we didn't find any other thing that would have accounted for his death, all right, the scientific evidence that I just explained to you and everything that we said, all right, was consistent with drowning. In other words, what we saw inside him are the things you will see when someone drowned.
Okay,
that is how we arrived at that.
Yes, exactly. And I'm seeing that in the report because I have a copy here. But let's read further. It says, based on the available evidence, the manner of death is unnatural, accidental. Just explain that a bit further for us.
Okay, thank you so much, Gardner. That's a very good question. All right. So when you do forensic work, all deaths that occur, all right, can be divided into natural or unnatural. All deaths. So if you see an old lady, 90 years old, they go to bed, they sleep, they die, that is a natural death. If someone get malaria, even when they are 3 years old, they die from the malaria, it's a natural death. So an unnatural death is a death that wouldn't have occurred if certain circumstances wouldn't have happened. So things like accident, when someone is driving a vehicle and they are involved in an accident and they die, we classify that as an unnatural death. Because if they were not in that accident, they were less likely to die. If someone were involved in a plane crash and they die, we classify it forensically as an unnatural death. If someone took poison, they poisoned themselves, we also classify that as an unnatural death. So that is it's a matter of just, classification of the death. So in his own case, we think that it was unnatural because it is something that was due to an accident.
Now, still on ways of death, I believe you have cause of death and manner of death. So the cause of death in this case is unnatural, but the manner of death...
That's the manner of death. So the cause will be consistent with drowning.
Well, we see unnatural and accidental. So the cause of death...
No. So unnatural is, accidental is a subset of unnatural death. So I listed a lot of stuff that can be unnatural. I told you about poisoning. I told you about, an accident, all right? Even when someone, shoots someone down, it's an unnatural death. Homicide, assault, those are all unnatural death. So in his own case, it is unnatural, but the aspect of that unnaturalness is the fact that this was accidental.
This is a bit confusing because the cause of death could be drowning and the manner of death could be maybe natural or unnatural. Am I correct?
Yeah, if you understand it that way, that's fine. But accidental is a subset of unnatural death.
Because saying accidental would mean that he was either maybe pushed in, he went to swim.
No.
Or he was pushed. He was forced into.
This is forensic language, and the language we use is universal. All right.
And so that's the confusing part, sir. Because if someone went to swim and died, that would have been.
Allow me to just explain. You call me on your show. When I'm talking, I expect you to listen because I'm pressed with time.
I was only trying to ask a question, sir.
If you want me to wait for you to talk, I don't mind you talking.
Go ahead.
But I don't want you, kind of voicing over when I'm talking because there becomes a little bit of, So we don't coin our own words. So an accidental death is unnatural. An accident can be self-inflicted. I can be driving my car and I hear something, that's an accident. It doesn't mean that someone pushed me.
Right.
So for anyone to insinuate that the fact that someone drowned and you call it accidental, or someone is consistent with drowning and it's accidental, someone must have pushed him. People go swimming and, they drown. People get drowned in their own swimming pool. All right, it's an accident, but it doesn't mean that someone pushed them. So for anyone to insinuate that the fact that someone said accidental, it means that they were pushed, it's just a sort of wishful thinking. The forensic thing doesn't work like that. There's a universal language, there's a scientific language. So if I said there's someone who knows about science, read it, they will understand it, they will not ask the question. I'm explaining because a lot of people who are listening to me are not necessarily people who know forensic language. And that's why I'm taking my own time to explain.
Okay, so could I ask a question, sir? Because many people want to get clarity on this accidental and stuff. Now, let's look at the fact or a scenario wherein, say, Levi went to swim and drowned, or he was actually taken and put into the water forcefully. How would you, in your language, describe those two scenarios?
Very, very, very good question. Very, very good question. And I'm going to track you back a little bit to talk about stages of criminal investigation. So when a crime occurs, which uses, as an opportunity to educate, when a crime occurs, there are 3 stages. The detectives are there. They go there to see where the suspects are, the school he went to, talk to the teacher. When did he leave the school? Was it right for him to go there without a parent? Did the school, call the parent to say, well, the guy came, but, there's no school, we are sending him home, and stuff like that. So the detectives do all of that, okay? So we do the scientific aspect, the crime scene, all right? So whether someone puts someone in the water or they went there by themselves, I will not be able to say that. So you on the radio, us here talking, if someone hold me and submerge me in water and I drown, if they call 1 million pathologists to come and do the autopsy, what they will find is drowning. But how he went in the water and all of that are things that the detectives are supposed to find out. So those are the things that they should go and find out. So we saw the end product. We saw someone who had died. We sought to establish the cause of death. So it's the same thing. If someone fell from a height, like, you are in the upstairs building, and you fell from the height and injure yourself, and you call a pathologist or someone to come and do autopsy, they will do the autopsy and say, well, the person suffered hair injury due to a fall from the height. But as to whether someone pushing or someone whatsoever, or we can also establish whether he fell because he was drunk, or we do toxicology. But it is not within our purview to say he was drowned because, we are not soothsayers. We don't do magic. It's science. 1 + 1 = 2. That is why, everything I'm telling you, if another pathologist comes, I will imagine that they should arrive at the same conclusion. It was the same thing with previous stuff we did. And that was it. Other people came, they shared the information. You have to think it's going to be consistent with drowning. It's a scientific process. So the aspect that you just raised is a good question you can raise to the police. That the autopsy has been done, it has been established that the guy, is consistent with drowning. But is there a possibility that someone pushed it in the water? Is there a possibility that he was held, down in the water, against his will by some force that was bigger than him?
Okay.
That one has to be, done by the detectives, and it's beyond the mandate that we have as pathologists.
Now let's squeeze in 2 quick questions, sir. The first one, is it possible for someone to be, I don't know how you would term that, but say the person was not conscious and got thrown into the water? Can you determine whether the person was conscious or not conscious?
Yeah, so when I started this interview, I told you that the question we sought to answer was he alive when he entered the water? Was he alive when he entered the water? All right, did he have other marks of violence? And the findings was consistent with drowning. He died as a result of water.
Okay.
So he must have been alive when he entered the water.
Now, let's look again at the next one. Bleeding.
So that's the final question, right?
Yes, that's the final question. Bleeding. If someone stays in the water for 3 days, and is it possible that after 3 days they would still be bleeding? Because according to I'm basing this on the coroner juror's own report, that they saw blood coming from Levi's body. So is it possible that after 3 days blood would still be oozing out of the person who drowned?
Thank you so much. I think you should do forensic work. You're a very smart person. All right. So when someone dies, whether they are in the water or not, they undergo what we call autolysis. They undergo decay. And you know, the body that you and I have, you will know, and then everybody know that when you look at your hand, you see some veins there. When you go to the hospital, that they can use the needle to take blood and other things. So those veins are there. Some of them take blood from your heart to the rest of your body, and that entire thing with the heart pumping the blood and all that stuff, that's the circulatory system. It made the blood to go around the body. When people die, the first thing we want to know, the heart will stop beating. All right. So in other words, that blood is no longer going around. Okay. The blood before that is kept inside the vein and the artery, the thing that are carrying the blood, the small pipe. So those pipes also can decay. They can get rotten. So when they get rotten, the blood that was inside there will waste. So if those small pipes, the veins and other things in your mouth, in your nose, if they decay and they burst, the blood that inside there and the skin is also getting a little bit rotten. So the blood that inside there will naturally waste. And you talk about, the 3 days, which, again, is a very, very, very good question. You see, I was in Maryland. It's so cold on the beach. I don't know how many of you have been on the beach. We went to the crime scene to see. I think the temperature was almost around 20 when we were there. The water is cold and all of that. So, when you even have fish and other things, you keep it in the freezer so it doesn't get rotten. So because of the temperature that we have, it's not hot. Before sometimes, the temperature will go up to 32 degrees and all of that. Right now it's around 20. Sometime in Maryland, it probably goes down around 18. It's pretty cold. So it was possible that the way the dead body will get rotting very fast, when they are outside in the very hot environment, they don't get rotting that fast when they are in the water in the cold environment. And that will explain why after 3 days, if you saw that body when he was taken out, the body was still fairly well preserved. And the blood that was coming out was because those veins that were in the blood, some of them ruptured because they were getting rotten. And regardless of the manner of death, their bodies will always, as the mortician, they can have blood coming out. So that explains why the blood was wasting. And when the blood wastes, it comes through the orifice and then hold the opening. If the blood were in the nose and other thing in the airways, it will come through the nose. If it was in the intestine, it will come through the anus. If it was somewhere, it will come. So that is why it is coming through there. And it took 3 days because of the kind of temperature we have in Harper now. It was fairly well preserved.
Okay, we wish we had more time because people are actually thinking that maybe the pathologists were contacted by some big person to alter the result or make it in favor so that it doesn't seem that there was a foul play. But thank you very much, Doc, for your time.
I will speak to that just in closing, all right? I don't know, but we have integrity. I've been to Maryland maybe once in my life. Our interpreter, Francis Kitty, was my boss. We went there one time. I don't know anyone else in Maryland. I don't have relatives there. We have integrity. You also have to know that this is a scientific process. I, Dr. Benedict B. Kolee, and my colleague, Dr. Zobombi, we don't have monopoly over this. So it doesn't look like anything we say in this is fana. It's a scientific process. It can be analyzed by anyone. It is absolutely impossible for us to have done that. But again, people can have perceptions. They are entitled to, those perceptions. There are people in America still that believe that Donald Trump won the election. Go pay the people. They believe you can't change their mind. But you see, we should not mix our perception with science. People, rituals and stuff, yeah, you can do that. But there's a clear dichotomy. There's a clear boundary between those perceptions and scientific reasoning.
Do you believe in witchcraft, sir? Hello?
It was nice having you. Thank you so much.
That was pathologist Benedict Kolee.